one of the areas that we had to solve was, does the ICG, does the BioZ make a difference? And very quickly, we had to figure out, okay, does it help or not help? Well, one of the big things, if you remember, we used a lot of beta blockers back then, and we had no idea, that's how we were generally trained, but that was one change we made when we realized the vast majority of these folks had elevated systemic vascular resistance. I'm guessing at least 90%. The other thing that's a little bit different about this, we have patients in the room, you can do blood, urine, EKG, etc., but we're actually saying now we're going to do something a little bit different. We're going to do this additional test. I have no idea whether they interpreted this as, wow, my doc's really concerned about my high blood pressure, we're doing this additional test. That probably had some effect. I'm not quite certain. We have not measured that piece. But in particular, when I actually demonstrate this, I'll point out these first couple bars through here, just tells them, hey, your blood pressure's up, that's why we're doing all this. But then I can specifically point out to them that this little area in here is measuring, is your heart going too fast, is it going too hard? And for the first time I can say, you know what, your heart's fine. Not a problem, not going too fast, not going too hard. If they're on beta blockers, we actually have some reasons to consider changing that. The other one I point out to them is down here where it says thoracic fluid content. Simply explain, not too much water in your pipes. Guess what? Because of that, that's not generating your high blood pressure. We don't need to use pure diuretics in this particular case. Then you point out the obvious, the one that's already circled over here. And we explain systemic vascular resistance by I just use my hand and say, hey, your blood vessel is squeezing down, it's too tight. They don't like that. And interestingly, I don't know how many of you have experienced it, I've had patients come back and said, I want another BioZ. I don't like those bars. So for the first time, they're visualizing their blood pressure, they're visualizing what's causing it, and they don't like doing that. It also helped us very quickly say, you know what, we don't need the beta blockers. GNC7 simply says if you have systemic vascular resistance updated, we use our ACEs, our ARBs, our calcium channel blockers, and that's what a lot of us have done. So we have statistics to go through this. I'm going to let Bob mention, or just go through this briefly, only because Bob's our Six Sigma statistic guy, and just a quick interlude if you want to
Well, and I'll make
make
it
a comment.
very short. The bottom line was, as some of you who were here years ago know, that the use of the ICG was very controversial, as an understatement. And so the question came, and we'll address this later in the talk, does it work or not? We did 4 pretty thorough statistical studies, and the 4 statistical studies, 3 of them done by outside parties, all showed that we did a much better job in those instances where we used the BioZ than when we didn't. And so we ran into a question, should you go with what people sensed they knew, or should you go with the stats?